Okay, hello everyone. My name's James. I'm one of the physios here at T4 Physio, and today I will be doing a webinar on whiplash, or as it's termed now in the industry, whiplash-associated disorders. Okay, so I'm going to start off talking about just briefly what it is, and then go through some of the causes and symptoms, and some of the kind of ways that we look to treat some of the symptoms that may occur. So, what is whiplash? A whiplash-associated disorder is a term used to describe injuries, usually to the neck, but can also be to the back as well. These are commonly caused by sudden kind of acceleration and deceleration movement. So this is the head suddenly going forward and backwards. Usually these can occur due to traffic accidents, but we also find that these might be due to whether it's kind of a sporting injury or maybe a fall or a sudden jerk unrelated to road traffic accidents. Symptoms display differently for different people. No one person is the same, but commonly ones that we see the most are things like headaches, general pain around the neck, and you can maybe get a bit of nausea and dizziness, and these may be both constant and due to moving around the neck and head or even shoulder area. So who do we see that is normally affected? Looking into some of the studies and research that is done around whiplash, again, it's commonly due to road traffic accidents or motor vehicle accidents, as it may be termed. Several people worldwide are affected by it per year, as you can see on the screen there. So 300 out of 1,000 people per year are seen or affected by these whiplash-associated disorders. In certain studies, it's also shown that women are more susceptible than men, with also in studies again showing that some women are actually showing slower recovery times to recover from a whiplash injury versus men again. Different recovery rates apply to different people and different severity of injury. However, it's quite common to see that it takes up towards 6 months, if not longer, to get a full recovery from symptoms of whiplash. So some of the causes and symptoms. Causes of pain from whiplash may be due to damage that's occurred, whether it is due to things like the muscles, ligaments, even the joints within the neck, okay? So this might lead to some sort of inflammation around these areas. So typically around the joints of the neck, we might find that inflammation occurs. Therefore, when it comes to movement, we're getting pain. If the muscles have become inflamed and tight, or some sort of strain to the tendons, what attach our muscles to the bone, or to the ligaments as well that give ourselves stability in different areas across the body. If these have got inflammation or they're strained and affected, with movement, we're starting to get some pain and discomfort. And also, if the inflammation is there, it can also be painful without the movement as well. So common symptoms are restricted or loss of movement. So if we are finding that we're struggling to look over our shoulder or look up and down, that is quite common. We may also experience pain with movement, like I just mentioned. So again, whether it is in the car trying to drive or looking over your shoulder to speak to somebody, then this is when the pain starts coming in. Typically, people can experience headaches, and also might find that muscles become painful and weak, so they're not working as well as they were. During kind of the first 24 to 48 hours, these are some of the more common problems, e.g. headaches. But then we might find that kind of after the initial 48-hour period is when other symptoms occur, whether it is, more severe pain, loss of movement, changes in sensation, pins and needles, things like that. So I'm just going to briefly go over this. So this is the Quebec task force, and this is what we kind of use as a scale to classify or assess the level of injury, really. So you don't need to consider this too much. This is more just for our reference, but just to give you an idea of kind of how we're looking at things. So kind of, a low grade is kind of maybe no pain or very little pain, and you start to get a bit of stiffness, maybe a bit of tenderness when we come to feeling around the neck, but nothing too extreme. Whereas further down, we might start to get neurological symptoms, so like grade 3, and grade 4. You might start to look at kind of change in sensation, down the arms or into the fingers, pins and needles. things like that, and very limited movement and pain. But we don't need to be too hung up about that. That's just to give you an idea of kind of how we can kind of look and classify patients, and then how we can, on top of what you present with us as well, and the information you provide us, how we can cater the treatment plan to you, really. So how can we help? So at T4 Physio, we're looking at a full holistic approach. We're going to listen to the psychological worries that you may have post-accident, for instance, if it is a road traffic accident, or the fears that you may have about movement as well, and try and reassure you on that front. But we're also, typically with physio, we're associated with the more physical side of it, trying to reduce the pain and increase that movement for you. So there's guidelines in place that we follow, and treatment and evidence-based approaches that we follow. So the NICE guidelines are a national kind of health guideline that we can follow as physiotherapists. And they suggest, through evidence-based research, that our treatment should follow a multimodal approach. So that includes things like hands-on treatment, so whether it is mobilizations, massage therapy for tension-type muscles, things like that. Again, looking at things like ultrasound has been shown in research to help for muscle pain. So we use ultrasound in the clinic to help with inflammation, reducing that, so in the muscle areas. Range of motion exercises, so we want to encourage to get movement in the neck. So it's important to not be too still. As long as we've got the all clear for movement, there's not been any severe damage to structures, we're clear to get moving. We don't want to be letting the muscles and the ligaments and things getting too stiff. We want to keep that movement to help reduce pain further down the line. We also apply home exercise plans, which involve stretching and strengthening exercises. But again, as I mentioned before, in the first 24 to 48-hour period, we don't really look to incorporate things like strength exercises, as we want to make sure that we're aware of kind of the problems that we've got, let things settle down a little bit around the neck, and that gives us a better idea of how we can approach and the problem you're experiencing. So that's all from me today. If you would like to get yourself booked in for a free 15-minute taster to come and talk to us, whether it's about a query on a neck injury or whiplash, or any other query that you may have for a problem, please use that link above, and I can also send that out to you. Also, if there's any questions at all, please fire away. Feel free to drop them on the chat in this webinar, or otherwise you can give us a call, get in touch online on the emails, or even through our social media pages as well. We're happy to answer any questions for you. Brilliant. Thank you.